We risk assess just like everybody out in the country, and it's important for him to be able to continue his presidential duties now, and even if he tests positive in the future. This is a time where we are certainly living with the virus, but we have a range of tools at our disposal to do that.
That's White House Press Secretary Jen Psaki amid an outbreak of cases among top officials here in Washington, including several people very close to President Biden. Here to discuss that and more is the president's chief medical advisor, Dr. Anthony Fauci. Dr. Fauci, thank you for being with us this morning. I want to get to the situation in Washington shortly, but first, the overall picture. We see cases rising in 21 states, hospitalizations rising in 11 states. What is your level of concern right now?
Well, obviously, there is concern that we are seeing an uptick in cases. As I've mentioned over the last couple of weeks, John, that this is not unexpected, that you're going to see an uptick when you pull back on the mitigation methods. If you look at the CDC calculation with their new metrics, it's clear that most of the country, even though we're seeing an uptick, is still in that green zone, which means that masking is not recommended in the sense of not required on indoor settings. But as people pull back, when you have a highly transmissible virus like the BA2, and you have pulling back on mitigation methods, at the same time there's waning immunity, we're going to see an uptick. So the numbers you gave are not surprising. What we're hoping happens, and I believe it will, is that you won't see a concomitant comparable increase in severity in the sense of people requiring hospitalizations and deaths. But the idea that we're going to see an uptick, I think people need to appreciate that that's the case and follow the CDC guidelines, because remember, when the metrics were put forth, the new metrics looking at the guidance of masking, it was said that if we do start seeing an uptick, particularly of hospitalizations, we may need to revert back to being more careful and having more utilizations of masks indoor. But right now, we're watching it very, very carefully, and there is concern that it's going up. But hopefully we're not going to see increased severity.
Regarding those mitigation efforts, I want to get your reaction to something that was written, an op-ed in the Washington Post by Dr. Leana Wen, a former public health official. She writes, quote, "At this point in the pandemic, we have to accept that infections will keep occurring. During the winter Omicron surge, almost half of Americans contracted the coronavirus. The new Omicron subvariant BA2 is even more contagious. The price to pay to avoid coronavirus infection is extremely high. Some Americans might choose to continue to pay that price, but I suspect most won't." And at this point, are we at the point where we have to accept there is going to be risk, there are going to be continued infections, and the cases, thanks to the prevalence of the vaccine, won't be as serious? We can kind of get back to normal lives knowing that there's a risk out there.
You know, John, I think Dr. Wen articulated that pretty well. There will be, and we've said this many times, even in our own discussions between you and I, that there will be a level of infection. This is not going to be eradicated, and it's not going to be eliminated. And what's going to happen is that we're going to see that each individual is going to have to make their calculation of the amount of risk that they want to take in going to indoor dinners and going to functions, even within the realm of a green zone map of the country, where you see everything looks green, but it's starting to tick up. So you're going to make a question and an answer for yourself, for me as an individual, for you as an individual. What is my age? What is my status? Do I have people at home who are vulnerable that if I bring the virus home, there may be a problem? So we're at that point where, in many respects, she's correct, that we're going to have to live with some degree of virus in the community. The best way to mitigate that, John, is to get vaccinated if you're not, to get boosted if you're eligible to be boosted. If you're in the certain group, like the CDC's recent determination about people 50 and older and individuals with underlying conditions, get that fourth boost, which, by the way, we really need to concentrate a lot more on that, about getting new tests, getting drugs, getting vaccines, which I hope the Congress comes through and gives us the resources so that as we get into what might be another surge, that we're prepared with all of the tools that we need to address it. And right now, if we don't get that support, John, we're not going to be ready for it.
Well, let me ask you about the spike we've seen right here in Washington. You and I were both at the Gridiron dinner. This is a dinner that had about 600 or so attendees. So far, I believe we're at 67 people that have tested positive who were at the dinner. I'm told, at least so far, no indication of anybody seriously ill, but you know, about 10% of those infected. What is the lesson here? Should we not be holding events like this, or to the point we just talked about, is it time to accept that we can have an event like this, but there's going to be a risk? Some people will test positive. If everybody's vaccinated, you know, it won't necessarily be that serious.
I think it gets back to what we were discussing just a moment ago, John. It's going to be a person's decision about the individual risk they're going to take. I think the people who run functions, who run big dinners, who run functions like the White House Correspondents' Ball, or thinking back the Gridiron dinner, are going to have to make a determination looking at the CDC guidelines and seeing where the trends are. I mean, there are some places you go, not only is it required that you show proof of vaccination, but you have to have a negative test the day you go to a particular place.
Yep.
And I know a lot of social functions throughout Washington and in New York are doing the same thing. And it's up to the individual to determine what their level of risk. We don't want to poo-poo getting infected. I think people sometimes say, well, it's okay to get infected. No, it's not, because there are things like long COVID, and there are sometimes people, even though they don't require hospitalization, John, they get significantly ill. They may be at home, they may require a doctor consultation, but they don't get hospitalized. That's not something to poo-poo. Again,
Sure.
Each individual will have to take their own determination of risk.
Dr. Fauci, we're almost out of time, but I do want to ask you about the potential risk to President Biden and his exposure this week. Obviously, he was at multiple events with people who later turned out to have been infected or in close contact with somebody who was infected. We saw him here's the bill signing. There you see him, you know, literally surrounded by people who were either infected or close to people infected. Several other events this week. Very quickly, what is your level of concern about the president's exposure here?
Well, John, the protocols to protect the president are pretty strong. The president is vaccinated. He's doubly boosted. He got his 4th shot of an mRNA. When we, people like myself and my colleagues, are in the room with him closely for a considerable period of time, half an hour, 20 minutes, 40 minutes, all of us need to be tested. Yes, he is mingling there, but we feel that the protocols around the president are sufficient to protect him. And as Jen said, the fact is he could get infected. We hope he doesn't. We do everything we can to protect him. But remember, he's fully vaccinated, he's doubly boosted, and most of the time people who get anywhere near him need to be tested. So we feel the protocol is a reasonable protocol.
Dr. Anthony Fauci, thank you for being with us this morning on This Week.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.